It is time to get up to date on the latest health news, including the safety and usefulness of e-cigarettes. And we've got three doctors here to help us do just that. Dr. Carm, Sebastian, Dr. Srini Iyengar, and Dr. Chris Wehr. Welcome to all of you.
Thank you.
Good to be here.
Well, let's start with these e-cigarettes. A new study of 1,000 e-cigarette users shows a majority of users aren't trying to quit smoking. And last year, the American Association of Poison Control Centers received just over 1,400 calls regarding accidental exposure and poisoning linked to liquid nicotine in these e-cigarette devices. Is this a better alternative for people who used to smoke traditional cigarettes?
Well, this is a great topic because this is so hot right now. Everyone's talking about it. And the main thing is that do patients quit quicker on e-cigarettes? And there's not really the evidence supporting that. But let me tell you personally, for my patient population, I've had a number of patients that have actually transitioned from smoke tobacco to e-cigarettes. But again, there's a lot of stuff we don't know. So I tell everyone, the devil you know with the smoke cigarettes versus the devil you don't with the e-cigarettes. But as we know, we've talked before, there's a lot of things about e-cigarettes we don't know yet.
Well, the concern, I think, is that it's not really regulated right now.
They're not FDA approved right now. However, there's a big push to get them FDA approved or have the FDA look at them within the next year. The most important thing is be very, very careful about the refillable or the reusable ones, because you actually have to pour the liquid nicotine in, and it's very toxic.
So there's liquid nicotine, we know that, but what else is in there? Any ideas?
Flavorings.
Okay.
And no, we don't know the rest.
Exactly. We don't know all the components that are in the solution.
Okay. And the fact that younger people are smoking these now.
And that's the thing. They're being marketed to a younger population. Kids are looking at it, hey, it's a safer alternative, but that's a false statement. You know, we really need to be cognizant of if smokers want to quit, we may be able to use this, but it's definitely not a safer alternative for children by any means.
No. Okay, now the jury is still out on the benefits of vitamin D. One review from international researchers found hardly any benefit to taking it. The other analysis suggested it may have what one specialist called a huge effect on lifespan, but the findings aren't definitive. Okay, Dr. Wehr, I want to start with you. What do we take away from this with vitamin D? My dad takes it. He thinks it's working. Should he continue?
I'm not sure how he knows it's working.
I don't know. I think he's been told it's working, so he thinks it's working.
Right. Well, I think that one important thing to remember is vitamin D is a vitamin, and a vitamin is a substance that's essential for health. And our body doesn't make enough of it naturally, and that's what qualifies as it a vitamin.
And is it not okay for us just to go out in the sun for 15 minutes? Is that not an adequate way to get our vitamin D?
I don't really believe that. I hear that touted around, and of course my patients ask these questions all the time about vitamin D and really all vitamins and multivitamins in particular. But there was a study in the 1920s that showed that 2/3 of children in Denver had rickets in the 1920s.
Right.
And if you think that people are getting more sun exposure now than they did in the 1920s, there's no way. And this is Denver. It's, you know, a lot more sun exposure than even Tampa. So yes, I think vitamin D is necessary, and generally speaking, I think it needs to be supplemented. And I think it's important for primary care doctors to test their patients for their vitamin D level.
Not all my vitamin D is the same. There's a vitamin D2, there's a vitamin D3. I mean, how do you know what to take?
D3 is the one that we're espousing as being the best supplement, that if you need to take one, D3 is the one that we're all saying that this is the one that you need to have. Now, again, though, Cindy, the big thing here is dietary issues. If you are not taking enough of, dietary vitamin D in, clearly you need to supplement it. If you're not getting enough sunshine, like we described.
What do we need more of in our diet to get the right amount of vitamin D?
Salmon has a lot of vitamin D. Your dark green leafy vegetables that we always talk about. Of course, your dairy products, if you can tolerate them. But remember, we're all using sunscreen. Look at this skin, right?
Beautiful.
So the sun, thank you. The sunscreen is preventing us from absorbing. So I take it. Important thing, though, is it's fat soluble, which means excess will stay in your body. Take the right amount, and the recommendations between 600 and 1,000 international units a day.
And this is really important, what Carm just mentioned. To everyone watching, really, it's not about hyper supplementation. So if you're getting it in your diet and you're getting the sunlight and your doctor's checked you out and you have normal levels, taking more isn't going to be beneficial.
Right.
It's about supplementing what you don't have.
Okay. All right. There's a fierce debate about mammograms in this country. How early and how often should women be getting them? The chief medical officer for the American Cancer Society says, quote, mammography does appear to save lives, but it is not as effective as people have thought.
Talk about a loaded statement.
Yes, that is a loaded statement.
The main thing here, reading between the lines here, each patient comes down to a conversation with her and her physician. The fact of the matter is that what the societies are stating is that mammograms pick up things that may not be cancer, which may lead to unnecessary surgeries and unnecessary procedures. Should a woman be put through this, or any individual be put through this unnecessarily? And the fact is, though, talk to a woman who was diagnosed with breast cancer early, and they'll tell you the mammogram saved my life.
Right.
So you have to go patient by patient basis. It's impossible to have a global, just paint this whole entire population and say no one under 50 should get a mammogram.
Right.
There's plenty of women who've been diagnosed under that age.
Every other professional society agrees that a woman should get a baseline study at 40, and then every 2 years until 50, and then every year thereafter 50 to about 80, and then after that we don't need them. The interesting thing and important thing is that mammograms now have less radiation and they find cancers earlier. They are the best test we have right now.
Dr. Wehr, your thoughts on this?
Yeah, I think one of the greatest values of this study and the other 3 articles that are in the same issue of JAMA are that it brings to light the fact that there is a negative side to all screening examinations. This finding of results that are meaningless, that lead to maybe a
unnecessary
biopsy
procedures
with complications of their own. So I think it brings to light, and the value of it to the physician reading the journal is that discuss this with your patient so that both of you can make an intelligent choice, that they're expressed to the patient that there is a downside to all this.
or there could be a downside.
And if your risk factors are very, very low, no history of breast cancer, age 37,
Right.
whatever, then maybe we ought to not start screening for breast cancer at this point.
Okay.
But I
all
think
right.
it should be an informed decision between the doctor and the patient.
Well, we have more to touch on, so can I get you all this? Just stay right there? All right, we'll be right back with more Daytime, so stick around. Welcome back, everyone. Dr. Carm Sebastian, Dr. Srini Iyengar, and Dr. Chris Weir join us again as we talk about the latest health findings. And we're starting this segment off with a rise in autism. A new federal report shows a 30% increase in the diagnosis of autism from 2 years ago. 1 in 68 children in the U.S. have an autism spectrum disorder. And a study in the New England Journal of Medicine finds that changes in the brains of autistic children actually begin in the womb. Okay, so we all want to know, is there anything that women can do to prevent this from happening while their child is in the womb?
Well, Cindy, like we should start talking about what they found in the brain tissue of these individuals, these children. The neocortex is a portion of the brain which was unusually different than the brain tissue in normal children. And the fact is, just like you mentioned in the intro here, that it starts in the womb. Now the question, though, is why is autism being diagnosed so much?
True.
The thing is, do we finally have a name for the diagnosis for the problem?
Right.
All these other issues, whether it be hyperactive, reclusive, these diagnoses probably fell under the umbrella of autism. So that's why another reason why we're saying the diagnosis is being made a lot more now. But I think that from that standpoint, it affects a lot of people in a lot of different ways. And Chris, I think, can comment on this as well.
I think exactly. I think the study also found there was a wide distribution of the incidence across the country, state by state. And part of that is exactly what he mentioned, is the fact that detection is much different state by state.
It was highest in New Jersey.
Right,
Which made me immediately think, is there something environmental in New Jersey that we should be looking at?
Possibly. I think autism, to get a little bit off track, I think autism is a combination of a genetic predisposition plus toxins in the environment.
Okay.
That's probably why we're having so much difficulty saying that's the thing, because it's a multitude of things. And when you talk about children, babies today are born, if you sample their blood at birth, they have over 300 toxins in their bloodstream at birth. So what are we going to do about that? But I think there is probably a genetic predisposition. There was another study earlier in the Journal of American Medical Association about the ApoE4 gene, which is for Alzheimer's disease, that we test for in adults. But testing children that had that at birth, they found changes in their neocortex as well. So this genetic thing is a very powerful thing, but that underlies perhaps a sensitivity to toxins down the line.
There's probably over 100 genes that they have discovered. We don't know which ones do what.
Right.
So what's the important thing for moms to be? Make sure you get your folic acid, because there's been a connection there, weak or strong, depending on the study you read.
Right.
Have good prenatal care. Don't smoke any kind of cigarettes.
None.
None. And the most important thing for these children is to get early intervention. So make a diagnosis early within the first 2 years and get intervention.
And they're finding, I read in one of these studies, the intellect of some of these children with autism is great.
Very high.
Yeah.
Savants.
So,
very high.
It's just it's a sense of helplessness, I think, for a lot of people.
It is, and again, what Carm mentions is really important for everyone watching, that the age of diagnosis, diagnosing them early, they have a better chance of being basically fitting into society later on. So under the age of 4, it's critical to make that diagnosis.
You can be very high functioning, autistic.
Yes.
All right. Let's move on to love, because it can sometimes break a heart, but marriage seems to do it a lot of good. A study of more than 3.5 million Americans finds that married people are less likely than singles, divorced or widowed folks to suffer any type of heart or blood vessel problem. Mr. Cardiovascular Surgeon here. Do you see this?
Well, I would say Chris is the surgeon, I'm the cardiologist, but we're both in the same type of field. But I'll just tell you, as a newly married man of 1 month
Who's going to live forever now.
Yes.
I can tell you that my heart is definitely under less stress. My credit card, however, different story. Sorry,
she
honey.
makes her own money.
The fact is, though, sorry, honey, I love you. The fact is the studies have shown happily married couples tend to have less cardiovascular outcomes or risks down the road. Now, that doesn't say that patients who have a predisposition for cardiovascular disease don't get it.
Right.
But rather, having a supportive spouse really makes it easier, or facilitates that patient getting through the process.
Which just goes to show how much of an impact stress has on our tickers. Really.
I was thinking how much of an impact love and
love.
connection with other human beings has to your
We
health.
are definitely pack animals. And so prior studies have shown that when we are lonely, our stress hormones go up, and all the good hormones, like our infection, being able to ward off infections, goes down. But, you know, the other thing is these guys don't really go to doctors. They may be doctors, but guys don't go to doctors. So when you're married to someone as wonderful as their wives, and I know both of them, they say, hey, go get checked out. And maybe that's leading to some of the early diagnosis and treatment.
What about for people who are maybe newly widowed or divorced, and they're thinking, oh, gosh, I got to go find somebody now to love?
Yeah.
Can you get the same benefits just from having close relationships with other people?
Particularly family.
Particularly family. So if you're estranged, make peace.
Church communities, family, those sorts of things are very powerful
And I'm
as
going to
well.
go as far to say even a pet.
Oh, get a dog.
That's right.
Even getting a pet.
Get a dog.
That positive, bond you have with an animal, and anything that's positive, it will help you.
My husband goes, I'm getting a dog.
Okay, well, they'll always be happy to see you, I'll tell you that. All right, a new study shows older, healthy women who consume 2 or more diet drinks per day are at higher risk for heart attack, stroke, and other cardiovascular problems. These women were 30% more likely to experience a cardiovascular event and 50% more likely to die from a disease associated with heart problems than women who rarely or never drank artificially flavored beverages. What? What is it about these drinks?
You know how I feel about this.
I know.
We have banned sodas, including diet soda, which I love, from my house. And what's going on with me, I'll just be honest with you, is now I'm trying to wean myself off of artificial sweeteners, because I realized that it reset whatever that is in my brain, telling me what sweet is. And now I want more and more sweet. So it's not good for you. It's not healthy. Drink water. The way I treat soda is 1 soda per week, and I use it as a dessert or a special thing. But these guys can tell you more about the heart.
Well, the thing here about this study, which is very interesting, is that they found the women that drank the most diet sodas had the highest risks of the cardiovascular complications. But again, if you look at the devil's in the details, you found that a lot of the women who drank multiple sodas a day also had diabetes, high BMIs, hypertension, smoked. So really, blaming the diet soda for all the problems, it's part of it.
Yeah.
So it may not be a cause and effect, but it might be indicating that, hey, this person has a really unhealthy lifestyle to begin with.
Right. It's this crazy conundrum that we have about people and sugar and sweetness. And for some reason, our brains have been reset to a whole new level of what we consider satisfying in our diet.
And just to wrap things up here, my sister, who lives in Canada, compared her baby food to the baby food that she found here. And the baby food she found here was much sweeter than what she was feeding her babies in Canada. So I think we're developing that taste at a very early age, and we have to retrain our brains to stop it.
Absolutely.
Right.
Okay, Dr. Wehr, Dr. Iyengar, and Dr. Sebastian, yes, that's right, Carm, because I always call you Dr. Carm. Thank you all very, very much.
Thanks for having us.
We will be right back.